Tonight, 13 Investigates is looking into complaints against the local cardiologist. One of his former patients says the doctor subjected him to dozens of heart procedures that were not necessary. The doctor insists he provides quality care, but several other patients claim they were also misled into painful procedures that were not needed. Our senior investigative reporter Bob Siegel shows you tonight why these patients are heartbroken and why other doctors say the cases raise serious concerns.
Rejoice in hope, because God's love has been poured into our hearts.
John Flum spends a lot of time with his Bible, and with good reason. In his retirement, this grandfather has chosen to be a pastor.
You kind of just let the Bible speak for itself a lot, I guess.
What John is preaching about today,
I just feel like it's imperative that I say something.
the reason he and his wife Susan invited us to their living room,
I think that our family has felt a responsibility to come forward publicly with this.
is to speak out about a cardiologist they once considered a hero. That cardiologist is Edward Harlemert. The Flums have filed a malpractice complaint with the state that claims the doctor performed dozens of unnecessary cardiac procedures on John.
We felt like he saved John's life over and over, when in fact, well, he just did a horrible thing.
Did the doctor do something horrible, or was he simply trying to save his patient's life? His attorneys tell 13 News Dr. Harlemert has always been committed to providing quality care to patients, and he treats patients based on their unique circumstances, his expertise, and the tools available. After all, John does have heart disease. In 2004, he had open heart surgery.
I had blockage in the what they call the widowmaker, and I received 5 bypasses at that time.
But it's what happened after that surgery
Our lives became a nightmare.
that the Flums are so concerned about. And they're not alone.
Are you troubled by what you see there?
Yes.
I have never seen this happen in the course of my medical career.
It makes no sense whatsoever.
13 News asked 4 separate cardiologists to review John Flum's medical records and the care he received from Dr. Harlemert. Each of the doctors told us the same thing.
John's treatment did not follow the standard of care.
And that's not standard of care.
Standard of care, no, absolutely. This wasn't standard of care.
We'll hear more from those medical experts in a moment. But first, I want you to understand what they're talking about. When a patient complains of ongoing chest pain, well, doctors usually recommend a stress test to see how well the heart is pumping blood. If the test is abnormal, the next step is a more invasive test called an angiogram, also known as a heart catheterization. It involves inserting a catheter, a thin tube, into a patient's groin area or arm. And then it's guided through the blood vessels to the heart, where a special dye can reveal clogged arteries. If there is a blockage like that one, well, doctors may recommend opening the blocked artery using a tiny balloon. That's called angioplasty. And sometimes they also insert a wire stent inside the blood vessel to keep it open and improve blood flow.
Just a dull pain right here.
Those procedures you just saw, John had a lot of them. When he felt chest pain after his bypass surgery, John says Dr. Harlemert would almost always offer to see him immediately to perform a heart catheterization.
Typically, he wouldn't give an alternative to it, like let's wait till tomorrow, let's try a different medication, let's modify this, increase this. No, we would go straight to the cath lab.
You know, if Dr. Harlemert said we need to do it, then we were, yes, let's do it. I wanted my husband alive.
Records show during an 18-month period from 2007 to 2008, Dr. Harlemert performed 13 separate heart catheterizations and inserted at least 20 stents in John's chest.
I mean, he was getting scathed almost every month. That's not how it's done.
Morton Rinder is medical director of the heart attack program at St. Luke's Hospital near St. Louis. He's been a heart doctor for 30 years, and he's been hired as a medical expert by John Flum's attorneys. He says heart catheterizations should never be used on a monthly basis simply as a diagnostic tool.
And the reason for that is because the procedure is invasive and it has risks.
Dr. Pyle Coley is a Harvard-trained cardiologist who works for KUSA, our sister station in Colorado.
Bleeding, kidney failure, more serious complications like a heart attack a stroke, a tear in the blood vessel, and in the worst case scenario, you can actually die from this procedure.
Despite the risks, medical records show Dr. Harlemert kept probing John's arteries over and over again, often telling John he found significant blockages that required stents. When is a stent necessary? Well, the American Heart Association says not until an artery is about 70% blocked.
This is the blockage right here.
Some of John's blockages did meet that threshold, meaning a stent was medically necessary, according to the cardiologist who reviewed his cath films for 13 News. For example, right there you can see severe blockage in one of John's blood vessels. Then Dr. Harlemert placed 2 stents, and after that, blood flow is improved and the blockage appears considerably smaller. But our experts say other arteries Dr. Harlemert chose to stent, like this one, seem nowhere near 70% blocked. Look at this. It's the same artery just before the stent, and they say there's hardly any blockage there at all.
Maybe 20%.
It was more like 30% here.
You don't need to open a 30% blockage.
And when it comes to a minor blockage,
Every blockage does not need a stent. In fact, the guidelines recommend against putting in a stent because, at least in the short term, you increase their risk of having a heart attack by putting in a stent rather than reducing it.
here's what Dr. Coley means by that. When an angioplasty balloon is inflated and a stent is placed inside an artery, sometimes it can do damage to the wall of the blood vessel, later causing scar tissue to form and creating a new blockage inside the stent.
The stents are getting blocked again and again.
That's exactly what happened inside many of the stents that Dr. Harlemert implanted in John, according to Kaser Khan, an interventional cardiologist who runs the Advanced Heart and Vein Surgery Center near Denver.
That's the scar tissue that is forming inside those bare metal stents over and over again.
Eventually, he stents the entire length of the vessel.
After Dr. Harlemert placed at least 20 stents in John in less than 2 years, so many of those stents got blocked up, his patient needed a second open heart surgery.
And you're putting wire mesh inside of wire mesh inside of wire mesh. In general, the more stents you put in, the more likely it is just to continue to scar down and close down eventually.
Yeah, putting more stents in actually made things worse, no question.
And even then, Dr. Harlemert continued to perform more procedures and implant more stents in John, a lot more. Medical records kept by the Flum show during a 7-year stretch, the heart doctor conducted a total of 44 heart catheterizations and inserted at least 41 stents in John, more than any of our heart doctors have ever seen in a single patient. Asked to explain the treatment he provided John Flum, Dr. Harlemert's attorneys told 13 Investigates because of stringent privacy laws and pending litigation, a response to a local news story is not the proper forum to present a picture of any particular treatment decision.
Can you think of any situation that all that would be justified?
No, there is not a single scenario I can think of where doing this level of stents and angiograms would be justified or make sense.
Dr. Sunil Rao agrees. The New York cardiologist is president of the world's leading medical society for interventional cardiology. After reviewing John's medical records, he told 13 News, "I have never seen a patient who has gotten this many procedures. At some point, someone should have said, what we're doing here is not working."
It's unheard of. I can't even imagine putting someone through that.
I just wanted it over with.
Through dozens of heart procedures, John says he became suicidal. Each time his chest would hurt, John began suffering panic attacks, knowing Dr. Harlemert would order another heart cath.
He would beg me, "Susan, don't take me. Please, please don't take me. I can't do this." But I knew that I had to take him because we were going to maybe save his life today.
At least that's what they say they were led to believe by Dr. Harlemert.
He truly made us believe that John needed all these, when in fact, now we realize that he did not.
Dr. Harlemert declined our request for an interview and would not answer any of our questions. His attorneys tell us the doctor's response will come through Indiana's medical review process, where the parties have the opportunity to conduct discovery and investigate the claims before facts and evidence are presented to an unbiased medical review panel.
Bob, is this doctor still practicing?
He is, Scott. Actually, right now, he's practicing up in Boone County at Witham Health. Over the past 30 years, he's also worked at Community Health, IU Health, and the Indiana Heart Hospital. And several of those other former patients have also come forward to file complaints.
What did he do to you?
ruin my life. I'm in pain 24/7, and there's no way you can get out of it.
13 Investigates has found over the past 7 years, more complaints have been filed against Dr. Harlemert than nearly any other heart catheterization doctor in Indiana. You'll hear about the other complaints when our investigation continues tomorrow at 11.
We're looking forward to seeing you tomorrow night and the rest of this story, Bob. Thanks.
We'll see you then.